Hello, good morning. Today, let us learn about cystic fibrosis. Cystic fibrosis is a progressive genetic disease that affects the lungs, pancreas, and other organs. There are close to 40,000 children and adults living with cystic fibrosis in the United States. And cystic fibrosis can affect people of every racial and ethnic group. So what happens in cystic fibrosis? Mutations in the cystic fibrosis transmembrane conductance regulator CFTR gene causes the CFTR protein to become dysfunctional. When the protein is not working correctly, it's unable to help move chloride, which is a component of salt, to the cell surface. Without the chloride to attract water to the cell surface, the mucus in various organs becomes thick and sticky. In the lungs, the mucus clogs the airways and traps germs like bacteria, leading to infections, inflammation, respiratory failure, and other complications. And for this reason, avoiding germs is a top concern for people with cystic fibrosis. In the pancreas, the buildup of mucus prevents the release of digestive enzymes that help the body absorb food and key nutrients, resulting in malfunctioned nutrition and poor growth. In the liver, the thick mucus can block the bile duct, causing liver disease. In men, cystic fibrosis can affect their ability to have children. What are the symptoms of cystic fibrosis? Very salty tasting skin, persistent coughing, frequent lung infections, wheezing, poor growth or weight gain in spite of a good appetite, nasal polyps, chronic sinus infections, male infertility. Cystic fibrosis is a genetic disease. People with cystic fibrosis have inherited 2 copies of the defective gene, which is called CF gene, 1 copy from each parent. People with only 1 copy of the defective cystic fibrosis gene are called carriers, but they do not have the disease. Each time 2 carriers have a child, the chances are 25%, 1 in 4, the child will have cystic fibrosis. 50%, 1 in 2, the child will be a carrier but will not have cystic fibrosis. 25%, 1 in 4, the child will not be a carrier and will not have cystic fibrosis. The defective cystic fibrosis gene, CF gene, contains a slight abnormality called a mutation. There are more than 1700 known mutations of this disease. Most genetic tests only screen for the most common CF mutations. Therefore, the test results may indicate a person who is a carrier of the cystic fibrosis gene and is not a carrier. Thank you very much.